Greetings, colleagues. Thank you for the kind invitation to join you today. I am unable to be with you in person due to long-standing visa and passport inequalities that continue to get in the way of sharing and learning that is so critical to our collective goals of promoting health, keeping the world safe, and serving the vulnerable. As you gather over these next 2 days to build on the work to develop a joint vision to strengthen clinical trials, I want to implore you to never forget the lessons we should have learned. Lessons which each pandemic, each health crisis, each outbreak of war, and each assault on our dignity as human beings continue to teach us. In the past and very much in the present, clinical trials that seek to find solutions for the sickness that keeps us from living lives of happiness and prosperity have been very white, very academic, and very exclusive. Community engagement has always been a nice to have, a suggested, a proposed component of clinical trials with little to no broadly adopted fit-for-purpose guidance. Community advisory boards, while critical, continue to present scientists with a way in which they can surpass and not budget for broader, more meaningful engagement with Africa in urgent need of a homegrown solution to fill the gaps that current guidelines have left us wanting at our point of need. Community engagement is the first budget line item to be cut. The budget line item always the hardest to defend. As activists who were told at the height of the pandemic that community engagement is not a priority when people are dying, the work that lays before us to continue to advocate for a higher level of consciousness from scientists and researchers is considerable. We need to center these discussions fully aware that having a seemingly robust system of guidance and frameworks did not prevent the remarkable wastage of research resources during the COVID pandemic, and we need to work towards a world where high-impact trial models become the norm and not the exception. The resources simply do not exist to continue the way we have been. Our national regulators must also be brought along for this journey, as we are in desperate need of conscious regulators who are able to adapt to the realities that communities face and to continue to make extraordinary efforts to collaborate with scientists to accelerate research. Our very lives depend on this. How soon we get solutions to diseases that afflict us depends on the ability of regulators to be agile. We must call for a higher level of consciousness in clinical trials. We must call on scientists and researchers to walk with us to decolonize and open up research. We must advocate for community engagement to stop being regarded as an annoying checklist item, but a component of clinical trials that hold equal, if not greater, weight than the science. Community engagement must be budgeted and paid for, and protected by scientific leadership. We must also realize that the systems, the frameworks, the status quo which we exist in today is not conscious by default. Behind our current reality are human beings who come to the table with passion, with love, with good intent, but also human beings who come to the table with prejudice, with bias, with lives and beliefs that might not have been exposed to or accepting of diversity. This is why we call for a new level of consciousness among scientists, because the driving force behind clinical trials are humans. We are communities who go to extraordinary lengths to support clinical trials. We participate in trials, we give of our time and our bodies. We prioritize the scientific agenda at times at great personal cost because we trust, we believe, we hope. We also participate at times because of the transport reimbursement we get from participating. Sometimes this is the only way a next meal is possible. And as a former participant said at a scientific gathering, every time I got my transport reimbursement, I walked home and used that money for vegetables. What more powerful reminder do we need that no matter how groundbreaking the science and no matter how well published the scientist, unless communities in all of our diversity can access the fruits of research, we will all be worse off. Of course, this means having the hard discussions with pharma partners at the outset of research to understand and secure post-trial access. This means safeguarding our national research institutes and civil society having oversight of these agreements to ensure that national research institutes do not do the market preparation work of pharma who have no intention of supporting post-trial access or knowledge sharing with the very communities that made that research possible. We must remember that the fruits of research will rot if they are not accessible to the human beings the world has intentionally excluded and inadequately served for decades. I implore you to look around the room you are in now and reflect on the faces you see, and in the next 2 days, the voices you hear. Have you heard the voices of those who use drugs? Have you heard more queer voices like mine? Have you heard the voices of the transgender community? Have you heard the voices of those who work with people in detention, those living in conflict areas? Have you heard the voices of sex workers? Have you heard the voices of pregnant and lactating people? Have you heard the voices of children? We must do this because we know that the billions of dollars invested in trials will come to naught If those who hold the power do not believe with their very core that without meaningfully engaging a diversity of communities, from protocol design to post-trial, the endeavor will largely be meaningless. Meaningful community engagement also needs to go beyond making input into the community sections of a guideline. It must make the conscious and deliberate effort to engage us in the fullness of the guideline, to walk hand in hand with us, to demonstrate your belief and conviction that any guideline, any tool, indeed any trial is richer, is more meaningful, and, as science has shown time and time again, has greater impact with community engagement than without. I wish you well in your deliberations and am excited at the prospect of a new vision, a new way that clearly demonstrates to the world that the time, the resources, the political will, the advocacy, and the resilience we have shown as a global health collective is not in vain. We will not allow it to be in vain. Thank you.